Are post-op pain meds putting you at risk? According to the CDC, nearly 3 out of 4 prescription drug overdoses are caused by prescription painkillers. The first exposure for many in the hospital after surgery. So what is the alternative? Here with the details, Dr. Jay Redan, who has more than 20 years experience in advanced, minimally invasive surgery. Good morning to you, doctor.
Good morning. How are you?
You recently authored a study that found that patients who received addictive narcotics after surgery were taking the medications almost a year later. Tell us about this study.
So what this study refers to is in Internal Medicine Journal is that people that are given narcotics in the hospital can become addicted, and certainly we want to get rid of that. So narcotics use, they have several side effects: nausea, vomiting, itching. They make people very woozy and dizzy. They can have breathing problems. So the goal of this was to really get to the root cause and stop this problem before it even happens.
So there can be a lot of side effects, as you just mentioned, after surgery using these drugs. Now, are there safer alternatives?
Absolutely, and that's why I'm here at the American College of Surgeons, is to share our knowledge with my colleagues and deliver this great medication to our patients so they can have these non-narcotic alternatives. So what we're doing is injecting this medicine called Exparel right into the surgical site, and what that does is it provides days of pain relief to people after their procedure, and therefore will use less narcotics, and therefore if they're using less, they have less chance of addiction, and definitely will have less side effects associated with this.
And do you think a lot of patients know about the drug, or do they ask for it or talk to their doctor?
Well, it's been only out a couple of years. I think this is a great alternative, but we definitely encourage people to talk to their physician about pain control after surgery. What I think a lot of people are afraid to do that, or don't, they're just expecting to have pain, but they don't need to have that expectation. There is alternatives now to deliver this pain medicine right into the surgical wound, and then they don't have to worry about all these other potential side effects.
And again,
informed patients are, I was just going to say, informed patients are our best patients, and I definitely encourage people to do their research ahead of time and share with their doctors and develop this great plan to eliminate the concern for pain after surgery.
And obviously the patients want to know that the drug works and works just as well as other narcotics, but at least there are no side effects, right?
Yeah, so what we did, the study I presented here at the American College of Surgeons, is we compared our traditional way that we take care of our patients with narcotics, and then we added the Exparel. So after doing that, we found there's a highly significant reduction in what's called fall risk, or the patient's chance of falling when they get out of bed and walk around, which we want them to do. They had much less respiratory issues, so they could breathe better, and then didn't need to go to the intensive care unit. Their intestinal tract worked much better. They were eating and being able to be discharged faster from the hospital with minimal pain, and therefore minimal use of these potentially dangerous narcotics.
And what advice can you offer to patients scheduled for surgery who prefer non-narcotic medications? Do they go ahead and just talk to their doctor about this?
Absolutely, they should talk to them. All of our patients now, I think everyone goes on the internet and does web searches for a variety of ways to treat their condition, and certainly pain management is a very important part of the comprehensive management of everyone. So I like patients to go online, check out all the different web searches, discuss the treatment plan with their doctor, and ask them about these other alternatives to treat their pain after surgery. And that's very important, and that's why I want to bring that message to our patients and all my colleagues here at the American College of Surgeons.
And you mentioned the drug has been out for a couple of years. Tell us about the history of the drug.
Well, it's a drug that actually is bound to a time-release molecule. So when it's injected, the local anesthetic, when it's injected into the surgical site, it's slowly released over a period of days, and then keeps the area essentially numb for this period of time. And its indications are for injecting into any surgical site. So it can be used for a variety of procedures. I myself do it on a lot of hernia repairs, complicated hernia repairs, a lot of colon operations. I know gynecologists are using it, just to name a few. It's continually being evaluated on a variety of surgical procedures, which is hopefully will expand its use and make a safer environment for our patients to have after surgery.
It sounds like an incredible breakthrough. Thank you so much, doctor. We appreciate your time.
Good, thank you.
To learn more about alternative pain meds after surgery, just head to the website or right there on your screen. Sean, over to you.
Dal, thank you.